I'm Tony Sklar with bnetTV. We are here at the mHealth Summit for 2012 in Washington, D.C. I am having the pleasure of bringing you people out there in bnetTV land a little bit of a panel discussion between Athtena Paulino from CTIA and, of course, Mr. Steve Barry from CCA. How is everybody today?
Fine.
Yeah, doing okay?
Very well, thanks.
Pretty excited to be here in Washington for a huge mHealth Summit.
Absolutely.
It's always a great show.
Impressed, large.
Let's get into some of the meat of why everybody's here at the mHealth show. And ladies first.
Oh, well, thank you. Well, this is a global event, a lot of energy, mHealth becoming more and more important. But I mean, those numbers that came out of the World Health Organization that said the U.S. was 37th in the world with regard to healthcare services, and we're spending more per capita than any other nation. Clearly, we've got a lot of improving to do. So I'm glad to see this has always been a great event, and I think we're going to find some of the answers that we need to move forward.
I'm going to go right into Mike. I mean, I could say lots of that, and I know you can too, but let's talk about what the CCA is doing here.
Well, this is a great growth opportunity for every carrier in the United States, every wireless carrier out there. I think we have a lot to offer and solutions. So obviously, I'm here to see what some of the solutions are that are being offered. We find that some of the policy issues are more of the limiting factors for bringing M into mHealth. This is all about mobile, and you can't have mobile with mHealth without mobile. So if you don't have the networks, if you don't have the policies in place so that we can actually build the networks, bring that service to the most difficult to reach, the most costly, and the most very often overlooked area of the United States, we're not going to be able to not only reduce our healthcare costs, enhance our healthcare programs, but also bring new services and new growth opportunity to rural America. And that's, I'm sort of here looking at what other people are doing, but also to find out where our wireless carriers, both large and small carriers, can jointly bring huge benefit to the American public.
America doesn't like to be in 37th place at all, ever, at any point in time. And clearly, when you look out onto this floor and you see the amount of ensuing technologies that are coming out of this country, it's invigorating. It gives vitality to the industry to say, we know that we're going from 37th pretty well to the top of the food chain just by looking out on these floors, because we're proactively doing something about it. And your two organizations, plus HIMSS, plus organizations like the GSMA, are doing a lot within this industry to make sure that compliance and standards are being met, that the proper education is flowing into the right hands, that the corporations are adhering to, the standards that need to be met, but that each areas that you guys represent of the ecosystems are getting their share of echoes and sentiments heard at the table. And let's go with CTIA first.
Absolutely, I completely agree with Steve. There's a lot that it blows your mind to see what's possible with technology on this show floor, and yet the regulatory environment is just not. We just got to get there. We don't want to stifle innovation. Of course, patient safety first. But absolutely, there are so many things that are technically possible, but just not policy, not in line with policy, and we got to change that.
A lot of policy going on upstairs, though.
Yes, absolutely.
A lot of policy being driven.
Well, I'm not worried about the innovation factor or the technology. You just look around the floor here and you see that, hey, it's got that
part's
space.
taken care of.
What I'm very concerned about is, for example, this FCC has had an enormous opportunity to advance the ball in building out high-speed mobile broadband in rural America, and they've fallen flat on their face in actually delivering. The reconstitution of USF and the creation of the CAF, which is the Connect America Fund. Sounds simple, doesn't it? Connect America. Well, what they've done is they've made it much more difficult for wireless providers to actually get access to the funds to build out those high-speed networks. Just look at their CAF 1 Phase 1 funding. They had over 2/3 of the monies available for the wireline companies refused to take the money because they did not want to be the carrier of last resort. However, on the mobility fund, every cent of it was actually requested and used in the mobility fund. There's $185 million sitting there in CAF 1 that really ought to be put into the wireless account. When they did their restructuring, they actually decreased wireless funding by 60% and increased wireline funding by 60%. Excuse me, M stands for mobile in mHealth. And if we don't have policies that are going to pursue the build out of high-speed mobile broadband networks, then we're not doing our job. We're not allowing these people with these incredibly innovative services to bring them to market. Our guys want to get to 4G LTE. We have the technology. We certainly have, in many cases, even the spectrum in rural America. We don't have a policy that this government is pursuing that's going to allow us to get there. It's a really missed opportunity by the FCC. They need to come to this show and get on board.
So that's a really good point, and Athtena, I want you to be able to speak to that. And why isn't the FCC all over this? I mean, chime in anytime.
Well, you know,
I want you to be able to say something, but why isn't the FCC a big part of this?
Well, I think they are a part of the discussion, but they're, I hate to say it, they're very wireline biased, wireline centric. If you look Friday they came out with their quote unquote new healthcare program regulations, or at least their initiative for NPRM. If you read it, it recognizes all the issues that we've been talking about, but is wireline centric. It doesn't recognize that those areas that are going to benefit most by lower cost and more access are going to be the wireless carriers providing it to those areas that may not even have connectivity right now. They're not going to build fiber in the ground and put it out in the areas that we need coverage in.
You got to jump in here before
Sure,
I do.
Sure, absolutely. And in 2013, we've made it a point that we also agree that the FCC definitely needs some guidance, and we are making it a top priority to, inform and guide FCC, FDA task force on mHealth. We absolutely want to be involved. We want to get some of these issues cleared up. I mean, intended use is still very ambiguous. We've got issues with regard to, it was very controversial, the FDA's report on mobile apps, and depending on what a mobile app does, they're treating it like it's a device, and we'd like to keep these innovative services in the hands of consumers, and it's a long road ahead.
How do we get the guys across the water over here to understand our way of thinking?
It's a process.
That's a nice sigh.
Well, as DC insiders know, and Steve's been at this longer than I have, but it's a process, and it's about keeping the dialogue open and absolutely informing and shaping the policy when possible.
Education is our most critical challenge right now, especially at the FCC. I think they're starting to realize that mobile is in fact more than a substitute service. It is actually and maybe the only service available. And we're, the carriers, we're working with some organizations now like nursing schools and to bring not only online educational opportunities, but did you know 4 nurses in the field with a mobile capability can do 16,000 service calls to individuals that are either locked in or without access in 1 year? 16,000 people could benefit from a mobile service. You're not going to get someone telling your blood sugar is high or low, or your heart is beat is erratic, or that you're overheating via fixed device. You're going to do that through a mobile app on a wireless device. It's about time that our policies caught up with the technology that's on the floor. I'm very disappointed that the FCC has had 2 opportunities now to make a real push to get get wireless services in the hands of the consumer, that person that needs it most out in the field, and they failed to be responsive. That's what we're for. I think both the members of CTIA as well as CCA would tell you this is why we're here in DC, is this constant educational opportunity with the FCC and Congress and the White House.
I definitely, go ahead.
And keeping them true, I think keeping the FCC true to its word. They recently issued a statement that they'd like to see mHealth become routine practice in healthcare in 5 years. So that sounds, doable. Let's go.
I would agree with you. They love to come out and say statements,
Right.
but following up on them can definitely be a challenge. I want to chime in on saying that we spent a lot of time in the fall in Europe covering multiple different conferences. A lot on broadband. Obviously, clearly, bnetTV covers a lot of the wireless space. So we're always speaking with the carriers, and we're always speaking with the standards bodies, the GSMAs, and both of yours as well. One of the things that I saw a lot of, Orange is a great example, and again, GSMA is a great example, where they've all got big healthcare initiatives, right? Orange, O2, British Telecom, all these carriers, they are just more than these fixed wireline guys. And the EU, their fund, which is very, close to the American fund to get everybody into the wireless, to get everybody connected, they're doing a better job. At the end of the day, they're doing a better job, and the reason why I make that statement that clear is because I see it when I'm there, that their divisions are their engines are pumping faster than ours. And I want you guys to comment on that.
I would say that the U.S. market is definitely stepping it up. I mean, you can look at the top 4 or 5 carriers in this country. All have dedicated not only some staff or some resources, but I mean they have C-level employees that are dedicated to health. Peter Tippett, as you know, is keynoting here tomorrow, and I mean his chief medical officer is. So as you can see, it's become a top priority, and I think we're gonna, if we're not neck and neck with Europe, we're gonna catch up very soon.
Well, my concern is, as I said before, you have to have mobile to have mHealth.
And you're so right. You keep coming back to that staple.
Which means we need networks. In Europe, they don't have an interoperability problem. We have allowed, and the FCC has been part and parcel to allow the bifurcation of our 4G LTE networks, the spectrum that is currently utilized. If you're a AT&T or Verizon customer, you also can't be a small carrier customer on a 4G LTE. If you're going to have ubiquitous capability with mHealth services that go across the board, you need interoperability, you need some standards that allow the 4G LTE rollout to be ubiquitous throughout every carrier. I represent over 104 wireless carriers in the United States. And every one of them would like to have a roaming partner and would like to be able to ensure that when you have their product and you come to Washington, D.C., that you can still get your text, your emails, your notice on your mHealth status. That's not the case right now. The FCC is supposed to set the terms and conditions for not only ubiquitous capability, but interoperable devices and interoperable spectrum utilization. We haven't seen that here like we've seen it in Europe. And now's the time and I know sometimes it's a difficult task, but that's why we have an FCC to set some policies that can actually drive this unique, innovative sector of the wireless community.
If I want to make sure that the viewers understand, your blood glucose monitor can't send a message to your wireless device to send a message off to its knowing partner to give that information out if it can't roam properly, and that's not good for the users, and that's basically one simple speck of a reason.
For an FCC that said that they were a pro-consumer FCC, you would think that this would be fundamental to them.
They just lock them down. Okay, so we've clearly picked on the FCC a lot, which we like doing. That's great. But let's talk about what we can do to turn that into the positive. What are the good things that are coming out of each one of your organizations that the members are excited about?
We're definitely excited about 2013 bringing a push for nationalizing licensing for medical services. I don't need to get 50 driver's licenses if I want to do around the United States tour. But as you know, doctors are required to be licensed in certain states, and that certainly, even though technology enables you to take care of your patients when they're remote, if they're across state lines, it really gets very sticky. So we're going to push for that, and we're going to work towards that to make all of this, which is, we see it here in a vacuum, let's make it a reality.
I agree. I mean, why shouldn't a doctor that's fully certified in North Carolina be able to help somebody that's in West Virginia or somebody that's in New Mexico? So I do think we need some standardization there. But the other issue is our carriers are trying to work with healthcare providers right now at universities and within their area to, number one, try to improve the education side of it, which is the ability for mobile to get out and help on the distance learning side, but also turn that into real positive results for the nurses that are developing nursing practitioner skills so that we can actually bring those services to rural America. And so our carriers are going to be there on the innovation side. I think they'll be there on the technology side. What we need is some policies in DC that's actually going to support that.
So jump in here, Athtena, and let's talk about how your organizations are helping support change policy.
Well, we are ramping up the technology, and as I said, we want to inform and guide the task force. We are going to be pushing on this national resolution services. We participate in trade shows like this, Medica in Europe. And as you know, it's almost like there's a team when it comes to mHealth or any mHealth event where they tend to coordinate. But as you know, CTIA and the Association, we're all about transformative growth and transformation. So, and it's funny. What do they say about 1,000 founder success? Success has 1,000 founders. So many people take and organizations take responsibility for transformation.
I'm going to jump in here for a second and say that today happens to be the 20th year anniversary of the first text. And it was 2 years ago at this summit that text was being launched. Johnson & Johnson's product has been young circle. And fantastic though that this has taken a good case study and proven it and said, hey,
Absolutely right. It's no longer what I call OTH, over the horizon technology. This is real, it's present, we can deliver. And there's a lot of the smaller carriers out there that are trying to figure out what their contribution can be, and hopefully together with some very positive, innovative policies, we can find a pathway, a solution for all of them.
So let's just sort of bridge the gap about the idea that not only do we have FDA regulation that comply with animal health, so there's compliance with these other FDA sort of protocols that have to be done by the FCC. Determined needs to do a 180 and get on board here. But three, there are international standards that need to be adhered to as well, because we are a global society, and this medical ecosystem that's part of the tech community is a global phenomenon.
Agreed. CTIA is primarily North America, United States based, but we are conscious of not developing that interoperability is the key to success. We will have those in mind.
Well, yes. Interoperability is the key to us here in the United States. Obviously, my organization is more focused on the U.S. Primarily, because that's where my members operate for the most part. And one of the things that we can do is look forward to, we're going to have cloud-based services and wireless access to huge databases. This is where I think the wireless carriers actually have a leg up and can provide not only privacy, but some type of security measures for all their consumer clients that are out there. And when you're accessing the cloud from anywhere in the world, and not just the United States, it would be good to know that there's a carrier in there that is going to be the interface between you and your very sensitive personal records. I think that's a huge opportunity for every wireless carrier to provide a little more personalized service capability and privacy and security that they haven't really focused on so far. And I think as mHealth expands, I think they'll realize, hey, there's a real functional role for wireless carriers, not just in providing the connectivity, but also providing some security on the other end.
So it's interesting, this is mHealth's conference, and mHealth's great global organization and took this conference from the NIH. The NIH did a fantastic job with the mHealth Alliance in getting it off the ground. And HIMSS comes in and they're able to sort of help that expansion globally. As you said, a lot of cloud-based solutions are going to be coming to the forefront here. I know, speaking with, again, I'm going to talk about Orange and Telefonica and a few of the other international carriers, their healthcare initiatives, their mHealth initiatives, they've got large departments that are dealing with a lot of these cloud-based solutions, and the organization's got to work together to help the lobbying, if you will, back to the governments. How does that happen, and why is it important to be members?
Well, for us, I think it's important because you've got a lot of smaller carriers that they're the department of a larger carrier to look at mHealth as the size of the entire payroll of the smaller carrier. So the more standardization, the more proven solutions that we have and are available, the faster the smaller carriers can get them out. And then again, the smaller carriers are somewhat innovative. So I think they can bring a lot to the table on new apps. We're looking at a few new apps right now that for the wireless carriers may not need a 4G connectivity, that work on a 2.5 or 3G MDM type of services that can actually enhance the health database that you may use. So there's a bunch of ways to get there. I think pulling together and promoting solid policy decisions that allow us to get there is the only way to go. And as the carriers get more and more not only initiated but comfortable with these solutions, I think we're going to see a real benefit to the nation.
And I agree, and I think that a good cross-section of industry players is very important. As you know, they're not all created equal, and even in our own regulation, I mean, components are off the hook, whereas an app is now upgraded to a device, and now it's all so. I mean, CTIA represents not only wireless carriers, but also, of course, their suppliers and the service providers of mobile data. And so we want all those voices heard so that regulation is not piled on in any one area and creating undue burdens for some, whereas others are not. So it's a big challenge.
Spread that policy evenly across everybody gets their fair share. How do we lobby and get these guys turned around?
Well, it's a slow process, but it is an educational outreach. Events like this are a good start. Events like our shows are a good start to have government officials talking to the people that are trying to find the solutions in the field. So, this is an ongoing process that's not going to happen overnight. But again, I keep coming back to my bread and butter, which is you can't have a solution if you don't have coverage. And if you're not mobile, then what is the mechanisms that you're using out there? I mean, I think some very positive progress on some of the deployment of 4G LTE services, getting carriers to an interoperable state where you can have devices, not only new networks, but devices that are interoperable, gives you a much further down the road, much quicker. And that's, we're still seeing some of the small carriers, they don't have access to smartphones that they need to provide these services. You can't put an app on a smartphone if you don't have a smartphone. So those are challenges that many of our smaller carriers are dealing with every day, and it's not really necessary. We have a digital divide, and unfortunately it's with the technologies that are in the handsets and the networks. So we really need to deploy them so that we eliminate that disparity, and that's what we're here for, is pursue positive policy changes. And on most of the policy changes, especially those that will bring wireless ubiquity to the marketplace, I think we have a common goal to get there as fast as we can.
Absolutely agreed, and education is the key, and that wireless ubiquity being the goal. I will say that it's nice to see the development in tangent where, yes, we are looking to, develop for the smartphones and all those amazing things that are possible, either through, commercial apps down to very specialized software devices, accessories, etc. But again, text for baby, text. All cell phones do text, practically all. So, creating that, those programs that are not really necessarily high tech, but very, very effective. I mean, have real impacts, real positive outcomes, and change the future.
Well, both of you have echoed the sentiments of the use of technology in the health arena needs to be continued to be progressed at a fast rate, and guys on the Hill got to get their act together and listen up a little bit more. That's what I'm hearing here. The organizations are working together. We seem to be on the same page.
I would like to see the Hill more knowledgeable, and I'd like to see the FCC much more focused on how do we bring this technology across the board. I keep going back to the fact that the innovation and this the necessity, the mother of innovation, and a thousand fathers. I think our carriers will actually deliver. Let's get the network out there. Let's get it built, and you're going to see enormous benefit. In England, I know if you probably noticed a couple weeks ago, they indicated they were going to move to essentially a teleconferencing, a Skype teleconferencing for many of their diagnostic first visits. They believe that will save almost $300 billion over the next 5 years in their healthcare system. If that's the case, then what are we doing sitting here talking about why the FCC won't approve $185 million for wireless broadband build out and another $85 million that's currently in their healthcare program for a wireless build out instead of putting limitations of 10 megs down and 4 megs up? That's get the product out there, let the people figure out what they want to buy.
What always happens, you get the product out there and the people are going to figure out how to use it, and everybody's going to make money. It's not like there's going to be, that's what happened when Skype first came to market, and AT&T was like, no, we're not going to let you use Skype on your phone. Yes, we are. No, we're not. Yes, we are. No, we're not. It went back and forth, and they found out, oh, wait a second, the ARPU didn't decrease, it actually increased, and we made more money. The more open that we were, the more money we made.
And we really need to think about the impact it has on our economy, our local healthcare systems. I mean, are we going to get to a point because of technology that you're going to go to the internet and do webcasting with a doctor in India, because they will actually see you and give you not only diagnosis but maybe medicines from an international entity out of Canada and bring that in the United States? Or are we going to actually be there with the technology to ensure that our carriers not only deliver but our citizens actually getting quality healthcare advice and consultation? It doesn't mean that doctor in India is not as good as the doctor here, but it means that doctor here also sees a lot of people in person, not just over the air. We'd like that person to be located in those rural communities that they're serving, not just a voice over the internet.
Well, I'm gonna leave the last note to you, Athtena.
Thanks for having me, Tony, and a pleasure to be on the panel with Steve. And we're looking for some really great innovations here, and more to come on mHealth in 2013 is going to be a big year.
Big component here at CTIA with the Door Health Initiative oriented. Absolutely. Well, it's always a pleasure.
Thank you. I really appreciate it. Enjoy it.
Clearly, she trumps both of us. So.
Absolutely.
Athtena, Steve, thanks very much for taking the opportunity to speak. Let's do this again.
Thanks. Look forward to it.
Coming to you here from the mHealth Summit in Washington, D.C. for 2012. I'm Tony Sklar, bnetTV.